I'd now like to demonstrate for you some habituation exercises that can be utilized in the clinic and at home for the patient's sake in order to help recover from a vestibular deficit. Now, habituation exercises are targeted at challenging the patient's balance to the point to where they are at their limits of sway or their limits of balance maintenance or stability. So, I want to quickly take you through some progressions and how we can modify those progressions in order to help better challenge the patient. What will be consistent with all of these exercises is head motion. Head motion is the most critical element. However, we can vary three systems. We can vary the visual input, meaning patients' eyes can be open or closed. If they're closed, that's going to be more challenging. The next thing that we can vary would be the patient's base of support. This patient is demonstrating now what we term a comfortable stance. The next stage of progression would be to now narrow that base of support and ask them to go into a Romberg position or their ankles touching. All right, and this would be the next stage of progression. Following this, we then ask the patient, if we wish to progress their base of support again, to do a modified tandem stance, which is to take a small step forward there, and now again, we've altered the base of support. The final progression in the base of support would be to ask them to obtain a tandem stance position, which is heel to toe. So go ahead and put your heel to toe and have it touch just like that. And those are the 4 variations for base of support. Now, the other variation that we can utilize is somatosensory input. And so go ahead and assume a comfortable stance position for me, please. And now to further progress them, we'll ask them to stand on foam. And again, we can take them through that same base of support progression. Considering the size of this foam, comfortable stance and Romberg position would be the 2 that I would utilize. Now, I have my patient here in a corner, and that's very important because the corner is the patient's safety net at home. What is the most important thing is that they're close to the corner without touching the corner. We don't wish to have any tactile or somatosensory input coming from the wall through the patient's upper extremity or torso. So, here in this position, we'll just go ahead and assume that the patient has been progressed to a compliant surface or a foam pad, and that we're going to start with a comfortable stance position. I'll ask the patient to perform head motion, both left and right. All right, so go ahead and look left and right for a period of 30 seconds or so to a minute. The clinician's here to maintain a guarding position for the patient. Next, the other motion that we would utilize as far as head motion is concerned is up and down or vertical. So for this patient, this is a quite easy habituation task. For certain patients, though, that suffer from vestibular deficits, this would be quite challenging. Assuming this was too easy, we could either vary the base of support, or I could ask my patient to simply close their eyes and perform the same head motions. Left and right. And as you notice, maybe a little bit more sway. And go ahead and look up and down now, eyes closed. Good. Very good. Go ahead and open it back up. Now, I'll ask the patient to assume an ankle touching position or a Romberg position. So now that I've varied the base of support, I would like to perform the same head motions with the eyes open in order to assess for the patient's proper safety and level of balance challenge with this activity. So go ahead and look up and down again for me, please. Good. And again, a little bit more challenging for her. And look left and right now. Okay. Again, just examples of how to progress the patient. Try it with your eyes closed now, please. All right, she does quite well, though. Bring your ankles together again for me. All right. And go ahead and close them again and look up and down, or left and right, whichever you prefer. There you go. So as you can tell, this is a normal subject, and she still has quite a bit of sway. So it's very important that you guard the patient. And again, keep in mind how you can modify all of the different structures, being base of support, or the compliant versus non-compliant surface, as well as visual fixation being present or suppressed. And you're able to create a very challenging habituation task for your patients at home.